So we will now continue. We talked about this idea of secure attachment. And I very much appreciate your questions. I think the questions that you ask are very, very important, very thoughtful. And from questions and from including challenging questions, no problem for me to listen to them, and I may not know what to say, but I will be happy to hear it. So you now have in your minds this idea that the children, all children, develop attachments. Sometimes they're secure, sometimes they're insecure. An insecure attachment is not an attachment that is weaker, less strong, but it is an attachment that is mixed with anxiety, with uncertainty. The child needs the mother exactly the same way like any other child, but the child's experience of the mother has been of caregiving that is not reliable, that is not sensitive, that is not based on what the child needs. The mother may have ideas that she read in books, or she may have her mother inside her head telling her, don't pick him up, you know, you will spoil him and he will never leave you. Or she may have an opinion of some doctor or somebody that tells her that she should let the baby cry because it's healthy. And the child may experience care that is insensitive. Insensitive means that it's not tuned in or not matched or not appropriate to what the child needs. Okay? And the child then will develop an attachment to the mother, but that attachment will be mixed with anxiety. The child is not confident that when they need the mother, she will really be available. Maybe it's a mother who is very happy when the child is happy and she's playful. She can play with the child and be nice to the child, but she cannot tolerate that the child is upset, unhappy. And she says that is spoiled behavior, okay? And she rejects the child. She says, oh, he'll cry it out. I was raised the same way, and you see, I'm pretty good, so he will also be, you know, will be raised like that. A child like that is not less attached to the mother, but his attachment or her attachment is mixed up with pain, with anxiety, because they know that to really get attention from the mother, they have to pretend like they're not unhappy. Unhappiness, sadness, stress doesn't really have a room. Or it could be another kind of situation where the mother is inconsistent. Sometimes she's very sensitive, and sometimes she's too busy with worries, maybe financial worries, maybe psychological worries, maybe the marital relationship isn't so good. And so she's sometimes available and sometimes unavailable. Sometimes sensitive, sometimes insensitive, okay? So the child is confused. Am I going to get what I need? Am I not going to get what I need? Okay? So it's a mixture of anxiety together with attachment. Some parents frighten their children, scare their children, yell at them, hit them, okay? A child who experiences maltreatment like that, abuse, needs the parent exactly the same, to the same extent that the child who gets very good and sensitive care. But that need is mixed up with a lot of anxiety, a lot of fear. Okay, so let me show a mother who is sensitive, just so that you get a little bit of a feeling of sensitivity. So what is sensitivity? Reading the infant's signals accurately and responding to them appropriately. Okay, that is sensitivity. And it's based on an empathic understanding of the child, or insightfulness into the child's experience. And I will talk more about this insightfulness in a minute. But let me first show you the mother of this cute little baby that we saw an hour ago, the secure little baby, typically developing. And we will see little segments of a home observation that we did of mother-infant interaction. So here we gave the mother a toy that we brought with us, and we asked her to engage the child with the toy. So she demonstrates. Now the kid is trying to do it by himself. He hands it over to her, just like she handed it over to him. So she's patient. She hands over this little toy hammer, but he's no longer interested in this game. He points out to another game that we brought, and she follows his lead, okay? She's not saying, wait a minute, you have to do what I say. She follows the lead of the child. Okay, you want to play with another game? Why not? She respects his wish. She's playful. She shows him how you can build the tower. She hands it over to him. She hands it over. And she's rewarding to him. She says, good job, good job. And now they have this little game because it makes wind. Okay, now we asked her to fill out a few questionnaires and for the child to play by himself. So this is very interesting. She's busy with what we asked her to do. We tried to imitate real-life situation when the mother is busy doing something. She doesn't have time for the baby. He's playing. He's happy. He made this vocalization, something like that. And she looked. She saw that everything is fine. She gives him the space. Okay? She doesn't jump immediately. You know, there's no need right now for her to do more than that. But she's certainly paying attention to what goes on there. So she doesn't know what he wants. So she's trying out several things. Okay, so she's patient. You want this, you want this, you want this. Eventually, he points out to something that he wants. You know, he doesn't have language yet. He's just 12 months. So he wanted whatever that was. Now they're going someplace else in the room to eat. I love this moment. He's busy, you know, with other things. But she was asked by us to feed him, okay? But look at how patient she is and the timing of her movement. She hands him something. She doesn't put it in his mouth. She offers it to him. He opens his mouth. And then she brings it to him, you know? So the timing is beautiful between them. Here, look again at this. Very gentle and affectionate. And very respectful of his autonomy. Okay, so that was just a little bit of an example of what a sensitive mother looks like in kind of everyday interaction around 12 months. In our study of the mothers of the children with autism that I talked about before the break, we also did observations of the sensitivity of the mothers in 3 different situations. We didn't do it in the home. We did it in our playroom. They played with a bunch of toys that we gave them for 7 minutes. They played with toys that we asked the mother to teach the child how to play. And they played also in a situation without any toys in the room. This is a very interesting situation. No toys in the room. You just leave the mother and the child, and you say you have 7 minutes now to play in any way you would like. It turned out that we got the most sensitive interactions during that segment. And this is very reminiscent of an expression in the DIR approach for treatment, which says, you are your child's best toy. So not a toy, not a car, not a ball, but you know? And what the mothers did usually was finger games or jumping games or running around and playing catch, or, you know, and you saw the children who before had a much harder time interacting really come to life, you know, because the games were very simple, very sensory motor kind of games, but very lovely, and gave the children a good time, and also the mothers, because they felt more connected with the children. So we rated the mother's sensitivity. I won't be able to explain how you do that, but there is a way to measure maternal sensitivity. And here you see the results of this part. Very simple. The mothers of the B babies, B is secure. Is the letter B signifies secure. The mothers of the secure babies were much more sensitive than the mothers of the insecure. These two groups, A, C, and D, on the right-hand side, represent insecure groups. So the mothers of the secure babies were much more sensitive to their kids. That means they were reading their signals correctly, responding to them appropriately, more flexible, more pleasant atmosphere, more accepting of the child's autonomy, more following the child's lead, not controlling the child. They did that much more than the mothers of the other kids. And this is irrespective of the child's cognitive level. This is not dependent on the child's cognitive level. Some of the secure children, like the one we saw before the break, had their cognitive level was very low. Okay? So this is not a matter of cognition. This is not a matter of the extent to which the child has cognitive delay. This is a matter of the parent's capacity, the mother's capacity to read the child and to understand the child better. And we saw that the mothers of secure kids did it much more than the mothers of the insecure kid at a higher level. These are exactly the same results you find with typical development. So this relationship between sensitivity and security, maternal sensitivity and child security, is exactly the same thing that you find with typical development, with typically developing children. So now the question is, let's go inside the head of the mothers and try to understand what are the processes that happen inside your head that help you be secure. Why is it? What are you thinking? What are you feeling inside of your head that enables you to read the child's signals correctly, to respond to them appropriately? What's the internal process? And we will focus today on two central elements. The first is insightfulness, and the second is the resolution of the diagnosis. So what is insightfulness? Insightfulness is the capacity to see and feel things from the child's point of view. To see things from the child's point of view, to understand how the child is experiencing the situation, and to feel it, to understand that, not only to cognitively understand it, but to empathize with the child's point of view. Okay? That is our definition of insightfulness. It includes the following parts. First of all, it is insight and acceptance regarding motives. That's the first part. That means to begin to think what is underneath the behavior. Behavior is not just what you see on the surface. Okay? And this includes autistic behavior. This is true about any behavior of a child. but also about autistic symptoms. You try to ask yourself, what is he trying to tell me? What is the message? What is the story? What is the function? What is underneath the behavior? You don't just look at the behavior. This is, for some parents, actually most parents, a very natural thing. So for some parents, it's a new idea that you don't look at behavior, but what's underneath, okay? Now, once you understand what's underneath, there's an issue of accepting it, okay? So, for example, from normal development, okay? You have a child who feels very scared in new situations. So you are a mother and you come to a birthday party of all the children in preschool. And all the mothers are coming with their children, and the children are saying goodbye, and the mothers have now an hour break to have a cup of coffee or to, I don't know, do what. Except my child, my child, clings to my foot, doesn't let me go, okay? It's embarrassing, it's stressful, but if I'm insightful, okay, I ask myself, why is it? What is causing the child's behavior? Okay, he's not doing it to make me upset, even though I may be upset. The result is I'm upset, but that's not the intention. There's a reason. He feels insecure. Yes, all the other children are secure. Okay, they can do it. My little Johnny cannot do it. I have to live with this idea. For now, maybe, if I'm insightful, I will probably say, in a month or two, he'll get used to it. He will grow up. His older brother was exactly the same. It takes them more, I'm such a good parent, they love me so much, they don't want to leave me so quickly. Just kidding, yes? Okay, so I'm both understanding and accepting. Understanding that the reason is insecurity, fear from new places, and accepting. Okay, I say this is a phase, it will pass. He's not going to, what mothers say, if they nurse for longer and everybody says, why are you nursing? The kid is too old. They say, okay, at 18, he will be no longer nursing, okay? So he will not continue to hang on to my leg, when he's 12. But now he needs it, okay? So that's insight and acceptance. The second aspect of insightfulness, an open, emotionally complex view of the child. That means to be capable of thinking about your child as having many different qualities. Some of them are they're positive in your mind. I don't know what. He's very good in sports. Or he's a smart kid. Or he's a curious kid. But some of them you don't like, are not very comfortable for you, okay? You don't like the fact that he's clingy, or you don't like the fact that he's not very social. He's more shy. But you are thinking about your child in a complex way. Your child is a whole human being with different aspects. Now, if your child also has some sort of diagnosis, okay, then you think, if you're insightful, you understand you have a child and the child has a diagnosis. The diagnosis isn't the child. The child has a diagnosis, okay? But that diagnosis doesn't capture who the child is, And there's an expression that they like to say in the field of autism, but it could be said in any field. You've seen one child with autism, you've seen one child with autism. There's an expression, you've seen one, you've seen them all. You know that expression. Okay, so they say no. You've seen one, you've seen one. The next one may be similar, may be different. The fact that they have the same diagnosis does not mean that they're the same. They can be very, very different. Their needs can be different. Their cognitive level can be different. Their sensory processing can be different. Their emotional processing can be different. They can be very different. They do share the same diagnosis. So complexity when it comes to thinking about a child with a diagnosis is to think about a child who, like any one of us sitting here today, has multiple aspects, multiple qualities, multiple sides. We don't want to be placed in a box, you know, and neither should we place the child in a box, okay? That's complexity. Openness to new information. That's the third part of insightfulness, okay? Which means you know your child and you know what to expect of your child's behavior, but you discover that your child behaved differently today. You hear from the teacher, you hear from the therapist, you hear from the spouse, your husband or wife. They tell you, you know what, he did such and so. Do you use this different than what he usually does? Do you use it as an opportunity to learn something new about your child? To learn that your child may be a little different than what you thought? Maybe a little bit, okay? Do you show openness? Or do you have this attitude that some people have? You know, we say, don't bother me with the facts. You know? Oh, he's like this. Don't bother me. I know already. You know, that's a problem to know. Because if you know too much, you don't let new information come in. And maybe what you know was true about your child until yesterday. But today, something new happened. And you say to yourself, you know what? You know what? I was wrong. Or I was partially right. But now, something a little bit different happened. And suddenly I realized that, yes, under these circumstances, he actually can learn much more. Or something, you know, you become more differentiated in your understanding of the child. These are the qualities that we look for in insightful parents of any child. And once you have this kind of perspective, this is the basis for sensitive and emotionally regulating parenting, and therefore this is the basis for a secure attachment. Because from the child's point of view, you are held in the mind of the child, of the mother, the parent, in a way that is secure, okay? So think about these qualities that I said on top here. Insight and acceptance, emotional complexity, and openness to new information. Think about it for a minute like you are the child, not the mother, the child. Somebody thinks about you like this, okay? They think about what you are from the inside, not only what you do, but what you are from the inside. They accept your motivations, even if it's against them. They see you as a whole human being. And if you change, they change with you. Now that gives you a feeling of security. You know, that's the mother or father all of us would like to have, you know, because that really gives you a feeling of confidence. I can be myself because the person on the other side sees me from the inside out, okay? So this is just a very simplified version. So the little kid says, I'm so scared of the dog. He cries. So number 2 is the insightfulness. Here's the neighbor's dog. Bobby must be scared. I should pick him up. This is what we imagine she's thinking, right? And then she picks him up and says, don't worry, mama's here, okay? So number 2 is insightfulness. Number 2 is this thought process that we think goes on in the mind of the parent, everyday situations. This is not insight like you maybe heard, like an aha moment. Suddenly you understand something very profound. No, this is ordinary. Parents do it all the time, particularly, you know, with babies who don't speak. So you have to kind of understand them without words. And the idea is that insightfulness would be associated with security, and lack of insightfulness with insecurity. So how do we assess this? How do we measure insightfulness? Because as I told you earlier, research is everything for us. You know, it has to be evidence-based. So we videotape the mother and the child during 3 interactions, and then we interview the mother about those videotapes. And we ask her, so we show the videotape 2 minutes to the mother, and we ask her, what do you think your child was thinking and feeling in this videotape? And she says, oh, I think he liked playing with your toys. Where on the video did you see that? So she has to base her statement on what's on the video. Okay? And she says, here you could see it, such and so, such and so. Is this, you ask her, is this typical of your child more generally? Does it show you something about your child characteristics? And she says, yes, this is very typical. No, this is very atypical. So we ask her, well, explain how it's typical. What is he like in everyday life? Is he like this also? Or if it's atypical, how do you understand why he behaved today different than otherwise? Okay? And then we ask her, how did you feel when you watched this video? Did anything surprise you, concern you, or make you happy? We show her one video, ask her all these questions, another, ask her all the questions, a third one. Okay, so 3 videos. It's a pretty detailed interview. We write down what the mother said, word by word, the exact words of the interview. And we have a very complex way of analyzing the interviews into 1 insightful category and 3 non-insightful categories. Now, the important thing is that is not whether the mother is right or wrong about what she said and what she said was going on in the video. So this is not an assessment of the accuracy of her perceptions. If she said the child was happy, do we agree that he was happy? If she said the child was anxious, do we agree that the child was anxious? No, that is not what we do. We just read her text and look for insight, look for complexity, look for openness, and look for acceptance, these things that I described to you, all in the text of what the mother is saying. So it's more understanding the thought process in the mind of the mother than it is the accuracy of what she's saying. In fact, we don't know if it's accurate or not. We don't even look at that. So this is a very interesting perspective that we've developed here. This is very related to those of you who are familiar from a psychological standpoint. Selma Freiberg, Alicia Lieberman, Mary Main, and Peter Fonagy have used the term mentalization. Elizabeth Maines used the term mind-mindedness. Arietta Slade used the term parental reflective functioning. I'm just listing this because these may be things that you've heard about, and they are quite similar to insightfulness. So we began by doing studies with children who are typically developing, and we did several studies like this, and we found the connection as expected. So when the mothers were insightful, in most cases, the children were securely attached. Okay? When the mothers were one-sided, what does that mean? Being one-sided is seeing the child either as only a positive child or only a negative child. So the problem is complexity. It's a difficulty seeing the child in a complex way. It also involves many times the tendency to drift away from talking about the child to talking about the self. So the mother will say, what was my child feeling? Well, I don't know, but let me tell you what I was feeling. And she can be very, very open about what she was feeling. But the question we had was, what was the child feeling? Okay? So it's hard for her to keep focus on the child. And it's hard for her to portray a complex picture. In most of the cases of these one-sided mothers, the children had an insecure relationship of the ambivalent type. In most of the cases, another type of non-insightful mother is the disengaged mother. This is a mother who finds thinking about the child's internal experience as a foreign, unfamiliar experience to her. Why was he doing that? What was he thinking and feeling, we ask her. She says, how could you know what anyone else is thinking and feeling, you know? He was just playing, you know? Oh, he was bored. You know, where on the video did you see that he was bored? No, it's not on the video. I know him. He was bored. Okay? So this idea of seeing things from the child's point of view, of jumping inside the head of the child to think what was going on in his mind is novel, new to these mothers. Okay? They are disengaged. There's something distant about them. Okay? We expect the mothers of these children to have kids with avoidant attachment, but we had very few children with avoidant attachment in Israel. That's a separate story. But we did see that the mothers were much less sensitive and the children had lower theory of mind scores. I will not detail it right now, why and what this all means. Finally, we have a category of mothers that we call mixed. They show different styles of speech in different parts of the interview. And we anticipated that their kids would have insecure, disorganized attachment. And that's what we found. So all in all, we find that how the mother is thinking about the child's internal experience is associated with the quality, the security of the attachment that the child was forming towards the mother. Okay? So the mother's capacity to be sensitive, to act in a sensitive way, is related to how she's thinking about the child's internal experience. And this is something that is very important when we talk about it clinically, because that means that if we want to increase more sensitive interactions between a parent and a child, we should not only pay attention to what we see, we should also pay attention to the internal process in the mind of the mother. Let's now jump back to our little kid with autism that we saw earlier. And I will give you a few examples of the insightfulness interview of his mom that we did with his mom. So here's one example. She said, he's smart, he's happy, I don't know, active, but on the other side, he can be very focused. So already in this first sentence, you see complexity, you know, because she says smart, she says happy, she says active, but also very focused. So you already get a little bit of a feeling from one little sentence of the different qualities of this child. And she continues. It's not that he's hyperactive, because she said active. She said active. She said it's not that he's hyperactive or that he doesn't want to play. It's as if he does want to play, but on the other side, the new room is disturbing for him. So all in all, he's calm, he's happy, but not very into it. Okay, so you get a view from this mother when she talks about the child that is full of nuances. You know, he's like this, he's like this. He's active, but not hyperactive. You know, but this is a new room, so that's hard for him. Okay, so you see how in her mind there is this complex process. Insight. He played with the doll a bit, gave her the bottle. What I think he's doing when he took the doll's diaper off, he always needs to check things out, to see how they're built. So he took the diaper off to see how it fits together. So she's looking at some very simple play of this child. This is the kid we saw who's cognitively delayed. And there was a doll and a diaper on the doll, and he took it off from the doll. And she's trying to imagine what might be the intentions, okay? I don't know if she's right or wrong. That's not what I'm asking, whether it's correct or incorrect. And plus, I don't know how I would know better than her anyway, you know? I'm more interested in the fact that she looks at his behavior and tries to think what's underneath the behavior. That's why we give her credit for insight, okay? Not an issue of accuracy, not if she's right or wrong. That's a really important point. It's for adopting this kind of way of thinking. He was very focused on the toys. He wasn't open to my ideas. It may very well be that because these were new toys, he was more focused on them than on me. So this is a great example of two things. First of all, of insight, okay? The kid was playing with the toys and not playing with her. And she tries to explain why. She says, because the toys were new. Okay, so she gives meaning to it. She goes under the surface. But also, imagine the situation. She wants to play with him. He doesn't want to play with her. He plays with the toys. But she doesn't begin to talk and say, you know, he's so difficult. He never responds to me. He doesn't like it, what I have to do. He's not responsive. Or she doesn't begin to complain with a long lecture of all the faults of this child. She's accepting that this is a child, that this is the child's preference is to play with something else and not with her, okay? And she doesn't take it as a criticism of her as a mother, which is easy to do. Acceptance. So acceptance is particularly regarding behavior which is challenging. I once served our family rice in a big pot, and he wanted the whole pot for himself. Okay, so next time I brought him only a little, and he took it all in his hand and ran away from me. It was as if he understood my plan to give him less rice and came up with a solution to the problem, to take it all for himself. I think he's smart, he can find good solutions. So, try to imagine the situation. She brings out rice, he takes the whole pot of rice to himself. You know, it's not exactly appropriate behavior, okay? So next time she does something different, she gives him a little bit separate from everyone else. He takes it with him. She interprets this as a kind of a problem-solving thing from his point of view, that he was trying to solve the problem, okay? So you see behavior that is challenging. It's difficult. And those of you who are parents or therapists of children with autism, you know there are oftentimes many challenging behaviors. It's easy to feel frustrated, angry, and so forth. And that's natural. It's not bad. But when she's asked about the child, when she is shown a video, okay, she is capable of putting herself in the shoes of the child and seeing it from the child's point of view and accepting this behavior. Yes, it's difficult for her, but she understands it. Sometimes I lay down to rest and he comes and jumps on me and hugs me. He's very attached to me. I see it as a positive thing, even though it does not fit his age. This is what he needs now, and I need to give him to him now, okay? So, okay, he's a big boy, and, you know, children with typical development at this age won't jump on her and hug her in this way that he does. But she understands it as his need for security. She doesn't get nervous about it, agitated, embarrassed, you know, because the main focus is this is what he needs for comfort. Okay, so this gave you a little bit of a feeling of what we mean by insightfulness, and we measured the insightfulness of the mothers in our autism study. And here you see the distribution. Most important, just look at the light blue and the rest. 42% of the mothers were insightful, okay? So this is a really large group, a really nice, big group of mothers who were able to talk with insight, with complexity, with acceptance, with openness about the child's inner experience, even though these children have autism and are difficult, objectively speaking, are certainly difficult to read. But these mothers, many of these mothers, had no big difficulty understanding their child and talking about their child in this kind of empathic way. This percentage is a little bit lower than what we see in typical development, which is around 60%. But that is quite understandable given the challenge that these children present. But still, it's a big group, okay? A big group of mothers. Very importantly, insightfulness was not related to the severity of the child's diagnosis, and not related to the level of the cognitive functioning of the child. So you could be insightful even if the child was, from a cognitive standpoint or from a diagnostic standpoint, severe in their diagnosis. So this is not the case that mothers are more insightful when the children are less severely impacted. Okay? So it's really not about the child's objective characteristics. It is more about the mother's capacity to put herself in the shoes of the child, and mothers can do it with children who are more challenging and lower cognitively as well. So it's really more about the mother than it is about the child. And we saw, like we did with typical development, so on the left there you see the insightful mothers, 19 insightful mothers, and about 60-some, close to 70% of them had children who were securely attached. Blue is secure, the letter B signifies secure. And the non-insightful mothers, the number of children with secure attachment was much lower. So it seems that insightfulness was associated, connected with secure attachment, just like we saw with typically developing kids. Basically, it was the same. The connection between insightfulness and security in autism was the same as it was with typically developing kids. But in the case of autism, insightfulness is not the whole story of what is going on in the mind of the mother or the father. There is another process that we talk about. We call it resolution of the diagnosis. In the case of children who receive diagnoses, such as autism spectrum disorder, insightfulness should also include coming to terms or resolving the diagnosis. In order to see the child behind the diagnosis, to be insightful, parents need to transform their representation of the child in line with the diagnosis. Parents need to appreciate, to understand, to accept that they have a child with special needs. He's not less of a lovely child. He's not less of a child, less loving of them, and they're not less loving of him, but it is a child with special needs. It is not a typically developing child. And this is, of course, painful, hard for anyone to accept this kind of realization, okay? But this is a process that parents need to go through in order to be able to accept the child as they really are. All of you as clinicians have encountered a situation where you're working with parents who have a really hard time adjusting their expectations, adjusting their behavior to the needs of the child. Now, I'm not saying that if parents are optimistic, this is something we should argue with. First of all, we are not prophets. We do not know how far along a child can develop. And believe me, we do not know. And there are many surprises in development. So when I say having positive expectations and hopefulness, it's extremely important to foster hopefulness. But the hope has to be related to reality, has to be related to what we need to accomplish today, tomorrow, in a week. What will be the best preschool for the child? What will be the best treatment for the child? What will be the best learning approach that we should use with this child? Okay? And to get the information and to accept the fact, the painful fact, that your child does need special help, that the child does have special needs. In order to assess the parent's capacity to resolve, to come to terms, to adapt to the idea that they have a child with special needs, two researchers by the name of Bob Marvin and Bob Pianta developed the reaction to diagnosis interview. It's a 10 to 15-minute interview in which we ask the parents, the mothers in this study, when did you first realize that your child has a problem? Tell me what happened on the day you learned of your child's diagnosis. Okay? For all parents, there is a certain day, a certain point in time when they went to a specialist, an expert, and they received a diagnosis for the child. For many, many parents, this is a very difficult day, very painful day. And people report memories of being in shock, of losing all hope, of the sky falling on your head. I don't remember how I drove home. I don't remember how I ever got home. I was like in a daze, Shock, disbelief, disorientation, searching for all kinds of other explanations, anger, blaming, all natural responses to receiving bad news like that. And we asked them to tell us about that day. So this is not an easy interview. We then ask, have your feelings changed since then? And a lot of the parents say that the feelings have changed. They no longer feel the same negative feelings that they had initially. And we ask them, do you have ideas about why you have a child with special needs? What do we consider as interviews that indicate resolution? First of all, it's actually not on this list here. Parents openly talk about the fact that they have a child with a diagnosis, that there is a diagnosis for the child. They talk about changes in their feelings. They don't feel today the same way that they felt 1, 2, 3, 4, 5 years ago when they received the diagnosis. They talk about moving on in life, Life has not stopped. Life is continuing. And difficulties, other things, but it's not stuck on the day that on that moment of getting a diagnosis. Parents sometimes are interested in why they have a child, what are the reasons, maybe medical reasons, maybe some people have all kinds of ideas from all areas of life, spiritual ideas, psychological ideas, but there is not, in parents who are resolved, this is not a central focus anymore. They will usually say things like, some people say like this, some people say like that, I don't really know, no one really knows. I heard a talk from David Oppenheim, he said no one really knows, so no one really knows, I'm not going to invest all my time, on some new ideas on the website, of some new ideas, I'm treated in this good place, I trust the professionals, and I'm moving on, okay? And when they talk about their child's abilities and disabilities, they have a more or less accurate representation of what the child can do. So here's the mother of this little boy with autism that we saw before the break. When did you first realize that your child has a problem? I felt something. He didn't talk when he was 1.5 years old. My other kids did talk at that age. Then he did learn some songs, but there was this worry. We thought maybe he had speech problems. Then the school psychologist gave a lecture on autism, and I decided to go. She talked about children with autism, and the things she said, I thought Ben had a lot of them. Okay, so let's stop here for a minute. What can we see in the response of this mother? She's very open to say, you know, that his speech was delayed. She was worried. Maybe it's a speech problem. But she decided to go to a talk about autism. So there was some question in her mind in this autism. And she heard, you know, the psychologist listing the symptoms. You know, you can imagine what she was feeling. But she's acknowledging, you know, he had a lot of them. You know, so she's open about this. He had a lot of them. How did you feel about it? The truth is, I felt I needed to find solutions to the problem. So this mother's orientation, we call it action orientation. She actually doesn't answer the question, if we want to be precise. We asked about her feelings. She's not talking about her feelings. She's talking about we need to deal with the situation. But we need to deal with the situation from the point of view of there is a special need here. There's no doubt in her mind. There was no doubt in her mind. There is a special need here. We need to deal with the situation. Her way of coping was to find resources, to find help for her child. When we started the treatment at the Center for Children with Autism, I had my own thoughts what would be good for Ben. And what I saw and felt there, how they join in with the parents, I felt that it was something positive, something that could help Ben. So she was looking for solutions, and she came to a center in Haifa, where actually my wife Anat works. And it's a center that has a lot of parental involvement. She didn't think that was a good idea, actually, initially. But, you know, she said, I saw how they were working, and I said, okay, I'm going to give it a try. So she's very open. She's very direct, okay? Have your feelings as to the diagnosis changed since receiving it? It's easier to know what the problem is than not knowing. So some parents, with all the pain of receiving a diagnosis, there's also some degree of relief. At least we know what it is, okay? He has progressed so much. Each day there is something new. He started to talk. He's more interested in people. So we really believe in him. We believe he will keep progressing. Now, she talks about his progress. Remember, this is a child who's low functioning. He has a few words. So this is not the case that this is a very easy child, or that this case that his autism is very mild. No. But she looks at the half full, you know, part of the cup. She sees progress, and she says, well, if he made progress, he'll continue to make more progress. Okay? Let me find out. No. I need to pull out mine. No. No. We think that having a resolution with respect to the diagnosis will facilitate the development of a secure attachment in the child. And we ran the resolution of diagnosis interview on the mothers in our study. And what you see here is that 33% of the mothers were unresolved, and 67% of the mothers 33 were resolved, and 67 were unresolved. Okay. These are very important numbers. I want to repeat them again. I will say it like this. Only 33. Only 33%, 1/3 of the mothers were resolved, and 2/3 of the mothers were unresolved. So it means that for these mothers of these preschool children, these are, remember the ages are around 4, 3, 4, 5. For many of them, dealing with the fact that they have a child with special needs is still extremely painful, really difficult. And I think this is natural. It's easy for us to understand it. But I think for us as therapists, for clinicians here in the room, which I know most of you are, this means that we have an important job to help parents with this process of coming to terms with the diagnosis. And I think that I cannot speak about what happens here in Georgia, but I can speak about other places in the world that I know very well, that there is far too little attention given to the experience of the parent, to the emotional experience of the parent, in a way that is understandable. The moment there is a child with special needs, we jump in with all of the attention on the child, and we believe that the earlier the better, right? I'm sure you believe in this too. We need to intervene early, and we need to be intensive in our interventions. So a lot of the focus goes on the child and less on the parent. And it's true in a way, the parents are not our patients. The patients, the clients, are the children. The parents, it's their child. But the parents are also, in order to be our partners in this work, we also need to understand their experience. We need to be there for parents. We need to understand the difficulties. We need to understand the questions that parents might have for the treatment that we offer. We need to understand the challenges that they might present to us. They might say, I read somewhere about a better treatment. Why does your center not provide this treatment or this treatment? We need to understand that it's a legitimate question. That's an okay question. It is not against us. This is not a personal thing. Okay? We need to be accepting that they may need to leave us and go to someone else. You may think that someone else is no good, but it is their right to do it, and you need to leave the door open to the possibility that they will come back to you, and accept that respectfully. Okay? So there's a lot of work that we need to do as clinicians to help the parents with this process of resolution. And it's easy for us to get impatient, maybe even angry at parents who do things that we think are wrong, okay, according to our expertise, rather than to see things from the parent's point of view, to really appreciate what it means from the parent's point of view. Okay? And I think that this is, that when you look at these numbers and you see that so many of the parents are struggling, you should ask yourself as a clinician, what am I doing with this? What am I doing with this lack of resolution in my everyday life? How am I showing to this parent, that I understand the pain, that I understand the anger, that I understand the hopelessness, that it's a natural reaction, that everyone will go, that it's like a loss, that you imagine to have this perfect kid, this normal kid, this healthy kid, and your kid is not. He's perfect, but in his own way, not in the way that you expected. And sure, you will feel all kinds of feelings, like we understand when someone loses someone. We understand that for a while, maybe a long while, they will be in a different space psychologically. So we should show that same empathy and understanding. And this should not only be the job of psychologists. This should be in the mind of every therapist, regardless of what your profession is. You can be a physical therapist, you can be an occupational therapist, you can be, I don't know what, some other forms of therapy, but keeping in your mind this idea of resolution, of the processes, of the going one step ahead, 2 steps back, 1 step back, 2 steps ahead. Life. Life is not like continuing in a linear way like your train here. We took it this morning. The train that goes from down to up, goes one direction and then back. But development doesn't occur like that. And coping with trauma doesn't occur like that. It goes like this in all kinds of unexpected ways. And the only thing we can do is try to understand it and try to offer parents companionship and empathy and affection and understanding. Yes, that this is really very, very difficult, and we're with you in this. Okay, that's so important. Many of the mothers in our study said that this was the most surprising thing. The reaction was, this is the first time anyone is talking with me about it. Now, these were mothers, many of whom had a lot of intervention with wonderful therapists, really. They got really good attention. But no one asked them this question simply and directly. Maybe some of the therapists didn't want, felt uneasy to approach the topic. It's so painful, it's so hard. Let's see about the progress your child made, or let's focus on the child, So there might be some sort of avoidance also on the part of the parents, of the therapists. Reaction to diagnosis. So being resolved or unresolved was not related to the functioning of the child and were not related to the severity of the diagnosis. So again, like with insightfulness, it's not the case that it's easy to resolve because your child is high functioning. No, this is a matter of your emotional process in your mind. You see in this slide, like the previous slide, that mothers who were resolved were much more likely to have securely attached kids than mothers who were unresolved. And now we put together insightfulness and resolution because every mother was interviewed both with insightfulness and with resolution. And this is where the results are really, really striking. So look at the column on the right. That represents mothers who are both resolved with respect to the diagnosis and insightful with regards to the child's experience, okay? The 2 interviews that I described to you today. And look at the size of the blue column, which represents how many of their children were secure. So of these 12 mothers, in a way you can say super moms type of thing, okay? 80% of their children were securely attached. The rest of the groups, if their mothers were, that's on the left, unresolved and non-insightful, that's half of the sample, or only resolved or only insightful, that's 10, then you see much lower levels of security. So it seems to be that this capacity to come to terms, to be resolved and to be insightful really helps foster a more secure relationship with the child, even though the child has autism and it's unrelated to the severity of the diagnosis or to the cognitive functioning of the child. Okay, very important implications for intervention, because we should be moving more of the mothers to the right column there. We should be working on resolution. We should be working on insightfulness, okay, in order to help the children develop secure attachments to their mothers. And it is possible. It is possible. I want to show one other slide before we're done. we followed up the children till they were 8.5. So now the children were in elementary school. And the children were either in a regular classroom. Okay, so now I will be talking about the level of inclusion of the child in regular education. Okay, so children can be, at least in Haifa, in 3 different places. One is a regular classroom, sometimes with an aide. Are you familiar with this, what it means to have an aide in the classroom? Sometimes they are in a special class in a regular school. And sometimes they're in a special school for children with intellectual disability and autism, so a segregated school. And of course, we want to move children more in the direction of inclusion. And what we see here is that in the children who were in a regular classroom, there was many of them had insightful mothers when they were preschoolers. And in the children in the special education school, you see it on the left, very few of the children had insightful mothers. So even though this is supposed to be based on the cognitive level of the child, there seems to be somehow an influence of the insightfulness of the mother on the level of inclusion that will happen with the child later on. How that happens exactly is a big question. We don't know the answer, exactly what leads to this. But this gives us an indication that this insightfulness of the mother in the preschool years may have long-term implications regarding the child's capacity to be more integrated in a regular classroom. And one thing to keep in mind is a lot of the reasons children end up in a segregated school is not because of the cognitive delay, but because of the behavioral problems. The behavioral problems of the children make it difficult to include them in more of a regular school. Okay? That becomes a problem. So it could be that the lack of insightfulness gets expressed in behavior problems, and that is one of the reasons why they end up more in special education schools. But clearly, we need to do more and more research on this topic. I want to point out to you in closing, and then I'll leave time for questions. Let me say a few words like this. I described to you today research that is about development, not about intervention. It has implications for intervention, but this is not research about intervention directly. And of course, all of us here in the room are interested, what can we do to help? What about intervention? Okay? And all of this research that I talked about, of course, points out to the importance of the interaction, the relationship between not only the mother, we studied the mother, but not only the mother and the child, but the father and the child and the important people in the child's life. So I didn't do research on this, but there's a very important researcher in England. His name is Jonathan Green. It's the last name that you see. He's the most important person. He writes his name the last. That's a tradition in medicine. Okay? The head of the group is the last name. Jonathan Green is a psychiatrist, and he did a study of early intervention with autism that focuses on enhancing maternal sensitivity. Remember that I talked about sensitivity? Reading signals correctly, responding to them appropriately. He did a beautiful, very rigorous, very good quality study of intervention with the sensitivity of mothers of children with autism. It was published in a journal called The Lancet. And those of you who know something about science and medicine know that the Lancet is one of the most prestigious journals. So this is very serious research. And what he showed in this research is that working on the sensitivity, he called it synchrony, it's very similar, the synchrony of the mothers to the children, an intervention that included 18 sessions, I believe, 12 or 18 sessions, had long-lasting effects on the child's symptoms, on the child's language development, on the interaction between the mother and the child. Really nice results. This is not an intervention to cure autism, okay? Autism, some people say autism is not a disease, so there's nothing to cure, okay? But this is an intervention designed to foster more optimal development of the children, to help the children move better along the developmental ladder. And this is one of the most impressive studies that has been done. And even though it is not about insightfulness and not about resolution, you know, it is very consistent with kind of the ideas that I've been talking about today. Of course, also the DIR approach that you may have heard about a little bit, and that my wife, Anat Oppenheim, is here to train, is also very consistent. It's not coming from the same theoretical background, and I can answer questions about that. It's a little bit different, but there is a lot of shared ideas in the DIR approach and in what I've been talking about today, a lot of consistency. So there are approaches for working with kids on the autism spectrum that are based on what we know about normative development. That's really important. You know, we know so much about normative, regular development of children, and we can use that knowledge in order to apply it to children with autism and help them make the most of the potential that they have on their developmental growth. So, thank you very much.